some pain in the foot after exercise, after a round of golf, which over a period of time became more acute, manifested itself more like a cramp, and then as time went by, that cramp became more frequent, so that once I walked maybe 100 yards, I got a cramping like sensation. But then once I stopped and rested for a minute or two, everything went back to normal. But as time went by, that frequency increased, so I knew something was wrong. My doctor, when I went to her, she thought it might be a variety of things, but one of the issues, or one of the areas that she thought it might be, was a vascular issue. So she referred me to my local hospital, who did a series of tests, including blood pressure tests, which showed up that there was an imbalance in blood pressure, and there was low blood pressure in the left ankle, which obviously meant there was some kind of blockage in the leg. And then once they had that result, they did further tests to actually look at the blood flow in the leg and diagnose the stenosis, or the blockage. Next step at the hospital, they basically did some x-rays. They did various tests, including what they call a pressure cuff test, where they test the blood pressure in your ankle, and also they compare that to the blood pressure in your wrist or in your arm, and they can tell by the differences of blood pressures as to whether or not there's a blockage, I guess. And that test did show some abnormality. So from there, then they decided to do further tests to try and figure out where the blockage was. And that was basically some kind of a CT scan with contrast to basically show up the vascular system. Yeah, at that point, once they had diagnosed that there was a blockage in the leg, it was quite a long lesion. It was about 20 centimeters, it turned out. And some of the treatment options they talked about were, the obvious one, or the initial one, was angioplasty, which is where they go in with a balloon to try and, I suppose, open out the artery. But that can be a temporary solution. The second option was to put in what's called a stent, which is like a scaffold into the artery. And then the third option, which would be the most severe option, was a bypass, a graft bypass of the actual blockage itself. Okay. Well, after that, they offered me, they told me about the possibility of 3 different treatments, but it wasn't really clear which one they were recommending. They seemed to be saying that the angioplasty was a less invasive treatment as such, but the blockage could reoccur. So, it wasn't clear to me whether I should have that procedure or not. And it also wasn't clear, if I did have that procedure, would that in any way affect a second procedure with a stent? And when I asked that question, I didn't really get a straight answer to it, which was why I guess I decided to get another opinion. I talked to some friends of mine, and also did a lot of searching on the internet, and somebody had mentioned Riverside, so obviously I looked that up on the internet, and looked at the facilities, and looked at Dr. Ansell's piece on the website, and decided that was a spot to go to get a good opinion. My experience at Riverside was very different, because number one, all of the tests were done the day before the actual procedure in sequence. So Dr. Ansel was looking at the latest results when he was making his decisions. And then on the day of the procedure itself, he had told me before the procedure that he had also found some other areas within my vascular system that looked to be occluded or blocked to a certain extent. So therefore, the original problem, while that was still there were other issues as well that he told me that he would treat during the one procedure. Yeah, I got far more than I thought I was going in for. So as well as fixing my leg, which had a long stenosis, he also found a problem with my subclavian, left subclavian artery, and that's an important area because it leads to the carotid in the neck, and so he also put in a tiny stent in that. And then finally, he had also told me that he was going to have a look at my heart, and because he's a cardiologist, he did that, and he also found an 85% blockage in the LAD, the left ascending. So that was obviously a big surprise to me, and I didn't have any symptoms beforehand. And I guess now looking back at it, if I had had the treatment back home or here in Ireland, then the danger was that they would have treated the leg, and the other two areas would not have been treated. And for me, that was the big bonus of going to Columbus. Everything. This procedure is magic because the day before the procedure you can just about walk 100 yards, and the day after the procedure I was walking downtown Columbus and I had to stop myself in case I opened the wound again in the leg, but essentially I could have walked for miles, no problem. So you go from a pretty limited state of mobility to full mobility overnight.